Hello, everyone. Thanks for visiting my channel. Um, so we got some news coming out in probably have been reading the issues in Afghanistan, and as well with regards to the coronavirus hitting Canada. Um, so basically, I'll be going over the issue with the U.S. intelligence aircraft that was downed apparently in Afghanistan. In Afghanistan, so we don't know exactly the culprit behind the downing of the aircraft. It seems like the U.S. has been reluctant to engage and accept or declare that it was downed by the Taliban. But some information here is from the New York Post, National Post here in Canada. Just pick that up, or just before that, it's just taking some time to load. Here from the Jerusalem Post, basically, they're saying that the Iranian media has claimed that many CIA officers were killed in a plane crash on Monday. The Taliban initially claimed large numbers of Americans were killed. So basically, they're saying that there's a lot of contradiction happening at this point of who was on board of this aircraft. It seems like they were on an intelligence mission. The Taliban stated that they shot it down, but it looks like the U.S. Has stated that it wasn't shot down, that there was a crash. It seems like if you look at the pictures, it's charred up. It's not completely disintegrated. So it seems potentially that there was an emergency landing that was probably happening, and it really didn't hit like a mountain or go like head on ground. It seems it was trying to have a safe landing, but it looks pretty charred up. The information that Michael DeAndrea's name began to appear in Farsi media. It seems like he's a senior CIA officer, and he was involved in some operations in Iraq, Iran, and Afghanistan. But it seems that the Iranian media is trying to portray that he was the mastermind behind the Qasem Soleimani assassination. So how much of this is true or not, we have to see the reports that would come out in the next few hours from the United States administration. They're claiming that it was just a crash. The U.S. administration stated it's just a crash, but it seems like Taliban is claiming responsibility for shooting down this aircraft. It seems to me, just from the pictures, most likely it wasn't a high impact collision. It seems like potentially they were trying to land safely, and maybe it was shot down. It does state here that the Afghanistan military was rushing and fighting off Taliban militants on their way en route to the plane. So, from this report from the Jerusalem Post, seems two people on board that plane are either missing. They're missing. They're not. Their bodies are not there. So either they have fled or they've been captured. So we're not too clear of the situation there. Let's see if there's any other information from USA Today. Okay. So the Bombardier E-11A is a U.S. Air Force electronic surveillance plane. Video from the crash site circulating on social media appeared to show its charred ruins. Yeah, it's definitely charred up, but it's not. It's disintegrated. Like it didn't really break up in pieces. So maybe again they were trying to do an emergency landing. So local Taliban have been deployed to protect the crash site. Two people suspect they may have survived the crash. This is from Afghanistan, USA Today. Razniwal said the site was near a village called Sado Kelo in Dehyak district. He also said the crash occurred soon after 1 p.m. local time, but residents in the area did not report a loud crashing noise. Excuse me. He couldn't say whether the aircraft had been shot down, but the crash was not loud. Okay, so this definitely shows that it wasn't a high impact crash. It was emergency landing, I would say, at this point. Okay. The website noted a Taliban statement saying that they found some documents on the plane, but the corpses on board were burned. Wow, what a start to 2020! Like crazy news by the hour at this point, and lots of plane crashes. This is or planes being shot down. Are they either they're by accident or for sure? There's skepticism on the previous plane crash incidents, but definitely it's a lot of skepticism on how these planes are falling. But most likely, it looks like planes are being shot down. Here, this is from the National Post. U.S. says it has recovered bodies from plane crash site after Afghan troops battled Taliban for access. Okay, so here it states that the United States has recovered the bodies. Okay, and then it seems like 2 are missing. The militant group claimed it had downed a special American aircraft on an intelligence mission. Now, whether they were on a low altitude mission, and maybe there was some technical issues on the plane, then the Taliban took notice or took advantage, they downed it, or they were able to disrupt this operation with the help of foreign forces there. Not clear. It's not very clear. We'd have to see in the next hours what are the statements that are going to be coming out regarding this. Okay. Let's see what else I see here. A U.S. defense official speaking on condition of anonymity Tuesday said multiple attempts had been made to recover the remains, but had been hampered because of the terrain and the weather. The Pentagon declined to comment. Okay. Interesting to see. I'd be very surprised if there wasn't any other foreign forces involved there to either down the airplane or try to take over the crash site. Like the Taliban, of course, are there, but it seems like if they actually downed the plane and it's an intelligence operation, they may have had some support from other groups in the region, Iran or whatnot, other foreign intelligence present there. Okay. The police chief of Ghazni province said a heavy Taliban presence had blocked the forces' retreat and returned back to the city yesterday. As per our information, there are 4 bodies and 2 on board were alive and they are missing. Afghan commandos were sent to try to get access to the area again on Tuesday, he added. The crash happened in the Taliban-controlled Sadokal area of Dehyak district. A special American aircraft, which was flying over Afghanistan for an intelligence mission, was tactically shot down by the Taliban. So again, U.S. Intelligence and U.S. Administration has come out and denied these allegations that it was shot down. But definitely, to me, it seems like the plane was on the way of trying to land, I would say, or trying to have a successful, safe landing, and it seems like it may have been shot down as that was happening, or it doesn't seem like they lost control from a high altitude. Definitely at a lower altitude. Okay. And what else do we see here? Another video footage shows more details of the U.S. military plane that crashed. While the cause of crash is under investigation, there are no indications the crash was caused by enemy fire. Taliban plane was carrying fewer than 5 when it crashed, with one official saying initial information showing there were at least 2. So there is contradiction of information happening at this point between what you're hearing from Afghanistan, from the Taliban, and from the U.S. administration. 18-year-long conflict. Interesting. And today, I think it's happening right now. There's a peace deal between Trump's new peace deal. So is that happening right now? Is a new? Let's see. Let's see, when does that happen? It's happening at 12 p.m., so it should be starting anytime soon. Trump's new peace deal with Netanyahu and the Palestinians. So this is going to be interesting to see what this new peace deal is encompassing. And we don't know exactly, but okay. We'll just wait for that to happen. I have this on my phone. All right, what else do we see here? New information about the coronavirus in Canada, where I reside. Quebec's health ministry investigating 3 potential new coronavirus cases. This is after that it was confirmed that a second case of coronavirus, the wife of the first person who has the virus apparently known in Canada, has emerged at this point in Quebec. There's also potential or if I'm mistaken, it's stating that 2 or 3 private schools in the Toronto area are worried that since they were on the same flight as the first confirmed carrier for the coronavirus to Canada. So there's 3 potential new coronavirus cases now, in this case, in this situation in Quebec. Amidst the confirmation by the Chinese authorities that 106 people died from the coronavirus, and which jumped almost by 100% within a few hours, or within, I think it was 12 to 24 hours of the first statement of 52 that died. So talking to people and discussing people who have family back in China, apparently the situation is really bad there. It's not what the media is trying to portray to us at this point. These numbers are really diluted and lowballed at this point. Again, if the real numbers come out in 24 hours, what they really are apparently, many people would be in panic. There would be shutdown of the economies. Apparently, at this point, more than 35 million plus people are quarantined in China. There's videos I was seeing on Twitter yesterday, videos of people from their balconies, saying we're going to survive. Let's say hundreds of people from their balconies in their homes. I guess they're stranded or not allowed to leave their home. So imagine what a devastating situation that is, to be locked down in your house. You can't even leave your house. I'm not sure how these people are going to get supplies, going to get food. How are they surviving? That information is not clear to us whatsoever in China. But we can know for sure now, this case hit the U.S. and now it's hit Canada. We know the incubation period of this virus is a week to 2 weeks, and it's gonna be very hot topic. I was in Toronto yesterday, and many people were not wearing a surgical mask or the N95 mask, which apparently some people are saying that this doesn't really do much for this infection because of the length of the vectors on this virus are quite small, smaller than 100 nanometers. That's what I heard, but I haven't been able to find much information on the details of this virus exactly yet. Mainly there's general information about the virus, like the symptoms that it causes and how it can impact the person's health quickly. But many people are not wearing the people that are wearing, to be honest, that I saw in Toronto are mainly Asian background. So mainly, you could tell that this has impacted them greatly, whether it's in their country or overseas here, like here in Toronto if they reside here. So many people that were from Asian background, they're wearing a mask, but I have yet to see many people that are from other ethnic groups wearing a mask. So it's interesting, but at the same time a little bit scary because this is going to be amplified on a much larger scale in the next couple of weeks. I would definitely see it's not something that's going to just subside unless the virus mutates and becomes less virulent, which potentially that could be the case. That could happen. But the viruses do mutate on hourly, on weekly basis. So there could be potential that this subsides and the virus becomes less virulent, and these situations was like amplified. A lot of people were getting sick, people were dying, but then the things sort of subsided and things came under control. We didn't hear about SARS. Since then, there was other issues, H1N1, the Ebola virus. So what else can we see here about Quebec? So early on Monday, health officials in Toronto confirmed a second presumptive case of the people who are still being tested for the virus as of January 27, while the fourth patient has recently tested negative. Okay, so there was actually 4 people, 1 person tested negative. Okay, again, because the symptoms are very similar to common flu, right? So when I was in Toronto yesterday, many people were sick, right? Like coughing, sneezing, people have colds, they have other, flu symptoms. So it's not necessarily that they have coronavirus, but because of this situation in China, it's affecting people like a stigma, right? Like imagine this thing is like amplifying like a wildfire and people are dying. It's pretty scary, very scary to know this, and at the same time you have to sort of think ahead. What if this doesn't get controlled, or if it amplifies to where people are dying in hundreds? You have to know what your plan is in your daily life. Are you going to take the risk of going to populous locations or populated areas to do your daily life or do your daily things, or are you going to plan to just wait on it, stay at home, stay restricted, try not to I would say definitely if you have any symptoms of flu or fever, if you're feeling sick, stay at home. Even if your employer may think, okay, you're probably just paranoid, but if you're sick, you're not feeling well, you got a flu, you got to stay home, no, regardless. You'd have to plan these situations in life, whether you're an entrepreneur or you own a small business or you work for a company. You need to plan for times where you're going to be sick. It doesn't have to be coronavirus hitting. It could be a situation of long-term disease or any kind of situation. You got to stay home. If you're sick, you're not feeling well, and you can't perform properly, and you could be potentially causing others to be at risk, you should stay at home and you should get well or go see a doctor and get well. That's very important to think this time. Like, we don't take things serious until they're actually very serious, especially with our health. We think we can, dig through it and handle it. We can just work through things. But when it comes to something that's dangerous, like this virus, there's a lot of reports coming on Twitter, a lot of doctors saying, oh, it's the flu kills 20,000 people a year, or these numbers are flying by. This is not as dangerous as the flu, but we have to see who's actually getting infected with the flu. Mainly the people that are high risk of getting a flu and dying are people in the elderly, or people with children under 1 year of age. So you can look that up. You can go to any agency or government health website, and they'll say the same information. So, but when you have tens of thousands of people potentially getting infected from the infants to the children to adults and elder and have potential to die quickly, then that's cause of concern because now you can we all know what happened in the bubonic plague. We all know what happened in many other situations where millions of people were affected and died. The common flu kills more people than coronavirus. Well, coronavirus, we don't know the effects of it yet. We don't know the real effects. We're seeing what's happening. I would say Chinese authorities to lock down 35 million people under quarantine. They have some idea of what this is. They have some working knowledge that this thing can cause lots of collateral, lots of damage, and we don't know again the crippling effects of the people that survive. Are they going to survive with disability, or are they going to heal completely from this infection if they do? We know that people are dying. You see the videos online, people walking in the street and just falling head first, on the ground. So, and people dying in the hospitals. Um, it's a very sad situation, very scary and serious situation that we have to understand that regular media outlets are not going to amplify this because it's going to cause hysteria. People are going to get stigmatized, and um, it'll affect the economies. So it's definitely a situation that people should be more aware of. I'm not saying not. You should rely on legitimate resources, but also use your common sense and knowledge of what's really going on there. To my knowledge, and from what I understand, is other people is going to spread in all of the world or not. Yeah, it's already spreading to other parts of the world. So again, we'd have to wait on this a couple weeks to see the incubation period. This again, it could be longer, could be shorter, depending on as well. It depends on the immunology of the particular person. If the person has a good immune system and may be able to handle this virus, but other people that are immune suppressant or immunocompromised, such as people with AIDS, people with cancer, they may have, or any other chronic disorder, they may not be able to handle this virus and its effects as effectively as a person who is healthy or has a stronger immune system to cope with such an infection. So that we don't know how it's going to affect, how it's going to spread. For sure, it's come to the United States, it's come to Canada, but the situation is not clear as to what's really going on in China. I have someone that I know that they have family exactly in the same province and same city. So when I asked him, he wasn't very specific, but he told me, Joe, it's not good. It's not good. So what's going on there is not good at all. But we'd have to know more how that's gonna amplify here in Canada or in the United States, because here we have more transparency in the media. We still have freedom to come up, say on YouTube, to go on other sites and show information, talk about situations. And that's the case, is that we still have that freedom available to us, and some transparency, as opposed to when you're in a communist nation or a communist country. That's obvious. They have complete control of what information is going to be sent out. So we'll see. I assume that if there's 3 confirmed, they haven't confirmed them yet in Quebec. We have 3 confirmed. You have to just look at your own self. If let's say you were infected with a virus, and how many people do you actually interact with on a close call, like a close direction on a day, like in any calm day, on your low days or on your high interaction days? I would say on the lowest day, if I'm interacting with anyone, would be like, just going to the grocery, going to put gas, run some errands. So at least you're interacting with 3 or 4 people. if not more, on your lowest days, on your lowest interaction days, on your highest interaction days, depending on if you're going to a highly populated metropolitan area or if you work in, say, uh, in an urban, suburban, in the suburbs, or um, I would say you're probably interacting with maybe 30, 40 people. If you're in a metropolitan area, you're probably interacting with hundreds of people if you're walking through at rush hour. So again, what is the time the time of interaction? How well the person is equipped from their immune standpoint, their immunity, can it handle such a virus? Can your body develop the proper antibodies to fight off this infection? Do you have a strong immune system? That's many questions that a person should ask. But again, the best way to prevent best prevention to prevent this virus from spreading is staying at home. So what Chinese authorities really reacted properly is I would say, is I understand people are sort of in lockdown in their own home, which is devastating, very scary. Imagine if it is deadly as some people are saying, that that you have a fate that you possibly could be dying in your own home. But the question is, yes, you have to protect the other populations. Are you gonna get treatment? It seems like they've been overwhelmed. And this 10-day hospital thing, I want to see that hospital built in 10 days. I would like to really see what kind of hospital they're going to get out in 10 days, whether this is just uh, uh, misinformation. We don't know. But we'd have to wait and see how devastating it is, really, with actual people, coming with family or friends there. Um, so the reports, some people reports are saying 100,000 people are infected and at least 15,000 are dead. Some reports are saying that's much more, millions are infected. At this point, we'd have to find more, video or footage. But from the footage, you can see that people are in an alarmed state. They're in a hysterical state in the hospitals, outside of the hospitals, and that picture or that video of the people on the balconies, like hundreds of people, just talking to each other from the balconies and saying, we're going to survive, we're going to get through this. That was really affecting me. Like I was like, that was quite emotional for me to see. Um, so we'll see how the situation works and here how this is going to amplify or expand. Hopefully it subsides, but we can see that in China it was, I think, the first 2 3 days there's 52 cases. You're talking about millions upon millions of people. Here in Canada, we already know that there is potentially 3 cases in Quebec, two somewhat confirmed cases in Toronto, a private school that may also have been on the same plane as the first infected individual. And so if you look at those numbers, technically you could have potentially, say, 10 to 15 people infected with this coronavirus in Canada, which is declared from the public health departments. But in China, the first 2 days or three, not the packed those areas were. So again, definitely there is some ambiguity in the numbers. So the numbers don't really match up as to the situation. But in any case, we're following the situation. I'm following the situation in Afghanistan as well, and the U.S. Army aircraft apparently carrying several intelligence members. It crashed, and the Taliban are claiming that they hit it. They shot down the plane. U.S. has denied this claim, and we're just monitoring closely. Apparently, a senior CIA official or intelligence officer was killed, and Iran media is stating that this senior senior CIA agent, was the one responsible for Qasem Soleimani's assassination and other attacks in Iran and Iraq. His name is Michael DeAndrea. So this hasn't been confirmed yet from the U.S. administration, nor the Pentagon has commented. So we're following up on that issue, and as well with the coronavirus in Canada and the United States. So thanks for coming and watching my channel here. If you like this information, and if you want, my platform is somewhat free. You can always comment. You can always interact with me here, and as well we can share information and come out to some reasonable consensus, in terms of what information is coming out. Because definitely in most situations, as we know, we have to try to get information from sourced material. But it's hard to believe a lot of info that comes your way, especially from sources that are mainstream, or that they have interests backed behind them. So we really want to try to get proper information. We want to get information that is real, that is true, and there is no political interest. There isn't any economic interest behind it. We want to get information that is real, and people that depict the situation the way it is, and let people make the decision on what's going on. So and make proper decisions on how to react when political and environmental health situations arise. So thanks again for visiting this channel, and if you please would like to subscribe or comment, that'd be great. Okay, take care, and I'll try to maybe get on live again this evening. Take care. Thank you very much.